nurse practitioner working in pediatric primary care. In my practice, which is recognized by the National Committee for Quality Assurance, my colleagues and I partner with parents to provide a medical home for approximately 2,800 children. Today in healthcare, a lot of people are talking about every patient having a medical home, or in my case, every child deserves a medical home. Many Americans, even those with comprehensive insurance, feel medically homeless when they try to navigate our nation's healthcare system. When they seek advice or treatment, they enter a system that financially rewards a patchwork of independent episodes of acute care instead of continuous coordinated care. While there's no single cure for the fragmentation of our healthcare system, there is a model that can help. The term medical home was first coined by the American Academy of Pediatrics in the 1960s. This model offers a potentially powerful alternative for improving care and patient satisfaction. At its core, the medical home is a concept that rests on a foundation of a long-term trusted relationship between the patient and the family and his or her healthcare provider. When patients have access to a medical home, they and their families are assured 24 hours a day, 7 days a week access to medical consultation, access to a personal provider who has respect for their cultural and religious beliefs, and they have comprehensive coordination of their care through various healthcare professionals and community services. See and hear for yourself why we believe there's no place like the medical home for quality patient and family-centered care. The medical home is an idea whose time has come. It is not a new concept, but rather a new blend of medicine and nursing, the best of both disciplines, where the primary care provider is comfortable with illness prevention as well as acute and chronic illness, though not necessarily the expert, where the provider knows that often the key to making the right diagnosis requires a willingness to listen to patients and families at length, and to sometimes need to do further research and investigation. It includes understanding a patient's temperament and their fears. The provider partners with patients to be available to them and help them through life's comprehensive issues, which might include growth and development, preventive care, strep throat, a pre-college physical, cancer, or maybe even autism. Where care is coordinated with specialists when needed, and it is understood that it takes the help of a whole office to provide a patient-centered medical home. Practitioners are ideal providers to lead medical homes. Trusting, holistic, culturally competent, patient-centered care is the foundation of nursing. Key dimensions in nursing care include respect for patients' values, preferences, and expressed needs, care that is coordinated and integrated, communication that is timely and accurate, care in terms of emotional support alleviating fears, anxiety, and pain. Nursing care involves family and friends and ensures a smooth transition with continuity. Today, many nurse practitioners, especially those in rural areas, serve as primary care medical home providers for many citizens. Without these nurse practitioners, many of these families would have no health care at all. Nurse practitioner-led medical homes reduce disparities in health care access, delivery, and outcomes. Qualifying nurse practitioners should lead medical homes and need to lead them in order to help meet the unmet health care needs of this country. Medical associations and industry organizations are predicting that the demand for primary care physicians will outpace the number of physicians taking on such careers. While the numbers vary and are sometimes disputed, a shortage is imminent.
The thing we love most about the practice is that they're available 24/7. That if I call on Saturday night at 9:30, somebody's going to talk to me, or come here and meet me if need be. Gigi is always really good with both of mine. I have a 5-year-old and a 2-year-old, and this one has had breathing trouble and all sorts of issues, and Gigi has not ever gotten annoyed with us because we were here 3 days ago, and understands. Nice, thank you. Understands what it's like to
If you have an urgent problem that cannot wait until routine office hours, you may reach Gigi, the nurse practitioner, on her cell phone at 244-7884. Press 0 to leave a message in the general delivery.
The medical home care model holds great promise for improving the health of all Americans and the satisfaction of patients and providers alike. Present data suggests that the patient-centered medical home is not only attractive to patients and their families, but will deliver improved quality at a reduced cost. However, more research needs to be done. Research about how this model of care should operate and the most effective way to implement it is underway. This model needs to be further tested in a credible, transparent way among different provider types and in different environments.
If you do that yourself, you can get it from the touch test.
People care genuinely about how my kids
Come because when we're sick or we need flu shot to help us not get sick. I got a flu shot.
7 years. Took Nicholas from lactation specialists all the way up to their present childhood illnesses. They're easily accessible. They're great with the kids, and it's an enjoyable thing to come here and see them and know they're getting
very family-oriented. It's like being part of your family, people you know you can trust, that you know care about your kids and care about their well-being, and are really there for you whenever you need them. So we're very lucky to be a part of the practice.
You feel better when you're sick.
Very good.
What's also important is there's always someone on the phone after hours. So whenever we call, without fail, either Dr. Brenman or Dr. Gigi have answered, and boy, that just makes a difference to a parent.